People would gain health insurance coverage. That's about 450,000 people would gain some form of health insurance coverage. The number of New Jersey residents with Medicaid would increase by nearly a quarter to about 1.3 million. This is likely to raise some big challenges for healthcare providers that participate in the Medicaid program. New Jersey Medicaid has some of the lowest provider payment rates in the nation, and if we increase the number of people with the Medicaid card, it may well be very hard for them to find a place that will accept it to give them the care. So that's a big challenge ahead. The number of people who buy coverage through the exchange or directly from a health insurance company, in other words, the number of people who don't get coverage through a job, but directly from an insurer, will increase the most. It'll go up about 150%. So our so-called non-group health insurance market will grow very rapidly. Among these, about 600,000 people will get federal tax credits to help them pay for their health insurance premium. The remainder are higher income folks over the 400% of poverty level who will be required under the mandate and who we predict are actually going to comply with the mandate to pick up coverage. In spite of these rather substantial changes for most of us, and I suspect this applies to most of us in the room here, very little will change. For example, we estimate that about 5 million people in New Jersey will continue to get employer-sponsored health insurance coverage. Some of the new rules will apply to employer-sponsored coverage. For example, the young adult dependent coverage rules, the ban on lifetime limits and benefits. But most employer-sponsored plans are grandfathered, and a lot of the other rules won't apply. So most of us won't notice any difference. Of course, those on Medicare will notice some differences, the prescription drug donut hole, preventive services, but for the most part, people on Medicare won't notice much difference. Now, I won't go into all the financing, how this is paid for, but a lot of it did come out of future planned increases in Medicare payments to so-called Medicare Advantage plans. That's one of the biggest chunks, so we're paying less to Medicare HMOs and the like going forward. Certain providers get payment rate cuts under Medicare as well, and that helps pay for everything I just mentioned. So let me close simply by saying that predictions are almost always wrong, that the numbers won't be spot on, but more importantly, we're operating in an environment of so much uncertainty with the Supreme Court, but even beyond that, say the Supreme Court upholds the law, some members of Congress have vowed to do whatever they can to repeal it. And depending on how the elections come out in the fall, there's a very good chance. I think it's unlikely that the whole thing would be repealed, but that many of these pieces would get chipped away at rather aggressively. So as Wiggs started out by saying, sometimes it's hard to be optimistic in this environment, and so I guess I'll end with that sentiment as well.